All right, welcome back to House Healthcare. We're gonna do a committee discussion here on a couple different things. So first, for this afternoon, we are doing a joint hearing with government operations. If you remember last year, we passed out of here, it went into the budget, a request for EMS to hire a consultant to do a study over the summer and fall of our EMS system in Vermont. And so I sent that to everyone. Hopefully you've seen it. If you haven't, I'm happy to send it again. So there's pieces of that bill, if we choose to take it up, that we would do in here, and there's pieces that government operations would do. And so we're going to do a joint meeting. We will be in here for the joint meeting, and GovOps will be in their own. We're going to do Zoom like we did a couple times last year. The witnesses will be in our committee or on Zoom. So that's how that will work. That starts at 1. I don't know what time that starts.
1, I think it's 1,
One.
but I wanted to say thank you for the 1:15. That's actually very helpful.
Yes, we'll keep doing that as we can. Yeah. I figured Friday you'd rather get home.
I think the 1:15 is, yeah, I think it's a.
Okay, so that's that. Let me know if you have any questions.
Have you send that to me?
Yes, I will send that out again. And is it on the committee? Yeah, I was just gonna say.
Committee page.
Oh,
Okay, I'll send it to you. Yes.
Is it on the committee page?
Under which one?
It's under, Will Moran.
Okay.
Today, yeah.
Yeah, under today, Will Moran.
So-
Don't-
We'll hear from Will or whoever he's sending to what they reported in the report. And then we'll hear from some of the stakeholders we've had in previously of what they think of the report. And then we'll, decide at a later date what we do and don't do with it.
And you got it?
Great, okay. Brian Chena, Representative Chena, who is testifying in another committee, sent out a request to see if anyone wanted to sign on to his mental health advocacy day resolution. I just sent it to everyone again. This is something that is usually offered every year. Mental Health Advocacy Day this year is the last week in January. So, but we need to get it in. So if you're interested in signing on, I encourage you to read it. It shows our support of mental health in the state of Vermont. Please get back to Brian today if possible. Questions on that? You want to say something?
I would add that it is supported by Vermont Care Partners, who represents all of the designated agencies for their mental health providers, and it's also supported by NAMI.
Great. Good point. Okay, and then our social compact bill and our occupational therapy bill were voted out of House Ways and Means unanimously. I believe unanimously. And now they are in appropriations. So Bobby, you just need to stay connected to their calendar to see when they're going to take it up. It could go pretty fast. It could not go fast. So, and feel free to check in with their committee assistant too.
Okay.
Because then once they vote it out, then it's on the floor. So you'll need to be ready. All right. So we've talked in the committee last year and other years, but we've talked a lot about peer support. And I don't remember if we did this in a bill or if we just said, please do this. Wilda White and OPR and others, including Daisy, have been working on what is the path forward, if there is one, for peer certification. So if you remember in the recovery world, they've had peer support for a while. In the mental health world, it's been slow to, and correct me anything I'm saying wrong here, Daisy, a little bit slower. And we've, everyone's kind of been saying we need more peer support in mental health. And we have potentially the CCBHCs coming on and the requirement of those peer support. The mobile crisis requirement could be peer support. So if you remember, I guess I'm just trying to remind everyone and make sure we're all in the same agreement that we've been working on this. And so now there is I had asked Daisy to work with stakeholders to draft a bill that we did not get in time to be a bill on the wall. So it is going to be a committee bill if we decide to move it forward. And so my plan, if no one is in objection to it, would be Tuesday after the budget address, we'll have testimony from Wilda White, who kind of spearheaded everything, and then walk through the draft language for the committee bill. It is draft, but I just want to make sure everyone's comfortable for that before we put something on the table and you're like, oh, well, wait, this, we haven't even looked at this. So it's draft, just like a bill off the wall would be draft. And we can, move it or not move it, change it as we see fit based on testimony. So hold on, Art, and then Leslie.
Yeah, I struggle with what peer support means.
Okay.
And I've heard 1,000 times in here, and it seems to me that if you are forming a committee group or something to take care of a problem, do you get the most qualified people, peer or not? That's my thought, but I don't know how that fits into what we're trying to do here, if at all. So that's what I wondered.
Okay. You remember we had Wilda in
Yeah.
at the end of last.
Oh, yeah, we've had her many times. Yeah.
And she presented the report that was funded last biennium
I think so,
Yeah.
yeah. Struck a time.
for the Peer Workforce Development Initiative.
Well, what does that mean? What's a peer workforce development initiative mean? What are we talking?
So,
Layman's terms.
okay, a peer in the mental health space is someone who has lived experience with a mental health issue and has experience in the system of care and it can help someone who's also in that
Yeah,
system
yeah,
to kind of guide them through it
sure.
and help them as they experience it, right? So it's not necessarily someone who's, medically trained, but it's someone who has deeper experience and has through this research that people have done, like very, very, what do you want to say? I think it's more recent clinical research shows that people who have the guidance of a peer
Mhm.
actually have better health outcomes, which
Okay.
is why this is becoming such a critical part of our mental health workforce.
So why do we have to do anything? What do we need to do? Just hire them?
So the whole initiative of why we funded that report is because we want Medicaid to pay for the peer workforce. These peers are already working in Vermont.
Right, I assume that.
But Medicaid is not paying for it. So we want federal dollars to pay for their salaries.
So we're gonna stop it there,
All right.
because we're getting into a lot of
I'm
policy.
just trying to understand. I don't get me wrong. I think it's a good thing. I just wonder. Yeah.
So these are all questions that we can talk
Yeah.
about Tuesday. I just want to make sure everyone is on the same page, that this is what we've talked about in committee, and we'll put a draft bill before us, and it will work through it like we do everything else. So Leslie, and then Alyssa, and then Melanie.
Very simple question. Is the language somewhere we can look at?
Yeah.
Yeah, we can send it to you.
That'd be great.
Alyssa.
Yeah, mine is really just jog my memory, because I think this was 2 years ago. Originally, it was because we have no certification,
Right. We can't bill Medicaid.
we can't bill because we have no certification
Right.
for peer support.
Right.
And
That's what this is.
okay, so
So
we're getting
this-
to,
This would
Okay.
set up, if you,
okay,
I don't remember who was here. I know you were here. I apologize, but we had a discussion of this a couple years ago, and there was a big disconnect at the time between OPR certifying and having someone else certify, and we
That
said,
triggers my memory.
go
Yeah.
figure it out. So this would be setting up that process. And someone who is working as a peer support person can choose whether or not to go through the certification is the way. So anyway, so that's what it is.
that's what we're doing is.
Yes.
Is,
Looking at that program.
okay, great.
Melanie, hold on
I was
now.
just gonna offer my support. I think it's great to do this because especially since we see how many places that it touches in our programming.
Yeah.
I'm excited to look at the bill.
Great.
There'll be a system in place You're just not gonna take any person that wants to be a peer.
No,
support.
we'll learn about the system during testimony. Yes.
I
Listen,
just wanted to comment that certification goes beyond being reimbursed, that it also sort of supports the workforce and the quality of the workforce and makes it dependable so that you know someone has a certain level of training and that's a good thing. So certification, I think, I value from both those points of view.
and that will all come out during testimony. Okay. Topic.
How does Human Services Committee get involved?
Yep, so I actually talked to Representative Wood. I showed her a draft of the bill. She is comfortable with us moving forward with it, and we'll just keep her up to date. Okay, so then the next thing that I have, and then I'll open it up. We last year decided that we were gonna have committee liaisons, you know, like someone was gonna be connected to another committee, and then I lost my list, and then I've asked people, and no one seems to remember.
I remember because you gave it to me 2 days ago.
Okay, great. So this is a shared responsibility of, whoops, we forgot. So I do think it's important, especially as we do more things as joint testimony, that we have committee liaisons. And again, it is, you know, keeping track of another committee's agenda to see if they're taking anything up that touches our committee, and or if we're taking anything up that we feel like this peer support is a really important one. Includes recovery at this point as the bill is drafted. Recovery normally falls under human services, you know, so we need to go to human services and say, you know, do you want to do this? You know, have the conversation. So I'm gonna open it up again to say who wants to do what. And Claire, do you mind taking notes on this and then maybe posting it on our webpage so we remember? Art,
I was in commerce, and I'm happy to
Okay.
continue to do it.
art is commerce.
And I guess I wasn't. I couldn't.
I'm not sure what the committee was,
remember.
but it was Lisa Engel.
Government operations.
Yes, and we do talk a lot, you know, and I say, hey, you've never come with me with anything, I said.
Okay, and so that's gonna be an important one because they're gonna be doing EMS. So, okay,
I know last year I had appropriations.
yes,
And I have handed that on to the very deaf Daisy Rebecca, who is doing such a better job with it than I ever could have. I am happy to take judiciary. I usually follow judiciary, and it's,
okay, anyone else have,
Wouldn't I have Human Services?
probably,
probably,
Probably.
can't get away from it.
Melanie?
Transportation and then the.
Okay,
Right there. A whole other folder of. Still.
Leslie?
I'm trying to think of what's left.
So, we have, are you gonna do human services? Yeah, do you wanna do education? That would be
I
helpful.
thought that's what I.
That's yours? Okay,
Yeah, I don't mind if you want to switch me around, but I already did it. It's-
right, yeah,
New people there this year. And I think.
we might need some people there.
I'm just looking at the list to see.
Yeah, well, Ways and Means is an important one. We don't have anyone for Ways and Means. As we pass bills out of here and they work on stuff over there.
We got, housing we don't have.
Are you housing?
Mari, volunteer Mari.
For housing,
Well, Leslie, you're here, so what do you,
all the ways and means.
okay,
You don't have to go, Tom.
Yeah.
You just open the door to listen.
Yes. Just all,
Brian, I'm giving you corrections, because he has a lot of. Mari's housing. 1, 2, 3, 4. 5, 6, 7, 8, 9, 10, 11. We just don't have ag. We don't have much that goes to ag.
Ag and environment and technology.
We don't have much that goes there either. I can track those.
The only thing with ag was food deserts. I was talking to them about that in terms of nutrition.
Wait, do you want 2 of them?
I'm in touch with Esme. It's
Okay.
fine.
Okay. All right, so Claire, can you read back to us?
Okay, we have Representative Peterson with Commerce, Representative Tamar with GovOps, Representative Services. And Field Education, housing and Regina.
And Rep Rebecca with appropriations. And you can put me in the other two, ag and environment and energy.
Oh.
You don't have enough work to do.
And hanging out in.
Or if you just want to anyway, or I could do ag and just follow their agenda, so you don't have to think about
Thank you
it.
for listening on ag too.
Hey,
If you can post that on our webpage so that we remember it. Great, thank you. And I would just say, keep Topper or Alyssa or I up to date if you see things happening in the committees that we should know about. And then think, as we're looking at topics and discussing topics, like, oh, all right, I need to remember to go talk to Lisa Hango about this thing we're doing, so, or whoever.
Is now an okay time to just mention one briefly? Yeah. So
Yeah, because we're opening this up now.
So I was in transportation a couple of days ago, and we have been anticipating a braided service report that looks at how public transportation is funded by Medicaid and how it's looking at providing efficient and equitable transportation, especially in rural communities that don't have a lot of fixed routes that serve people. And one of the things that came out in the report was looking at how the funding model from Medicaid is per member per week for reimbursement, and it's $40. And so if my friend Penny here goes 10 times in a week, he gets $40 reimbursed for Medicaid. If I go once, I get 40. And so what we're finding with the ways that it's landing with our local transportation is that they are struggling to be financially and fiscally sound, because it's not by mile, it's not by distance, it's not by rate, any of the things that really are the true costs. So there's been an ask when I was in, Representative Coffey said that we should consider getting Diva in to testify on how the reimbursement's done, and then also how the distribution is done throughout the state, because Diva gets the money and then gives it out to the different agencies that are providing the services. And so that would be something that would be helpful to understand, because we're coming towards a cliff in transportation and the funding, and it's absolutely essential for people to get the care that they need. And it touches all of the edges from healthcare, people aging in place, substance use disorder, what children need. I mean, it's every single thing we talk about. So I would that was an ask.
Yeah, and great explanation or a review, and to your point, I mean, we hear a lot about transportation in this committee, and people, especially with the rural nature of our state, people are unable to get to their appointments. And then if everyone remembers, Melanie wasn't here at the time, but I think it was last year that we added money to the BAA to help with the transportation piece. And so that's great to stay connected with that.
And that's been the process, like that's kind of what people count on, but going forward, that might not be the best model.
Change the model.
And so the transportation asked for those studies to be done so that they could look at whether there's like risk corridors, different types of brokering, different ways to use AI. And so that was some of the work being done, but a big thing is how Medicaid is done. And those are entitlement services, so you have to provide them. And which is great, we want people to, but if you can't afford to, then there will always be an ask for a BAA or budget adjustment, all right, budget works. So
Exactly.
Yep.
Great, thank you.
Yeah.
Does this include the private, like me driving someone to a doctor's appointment?
If you're
Now
a volunteer driver-
volunteering to do that, does this include those people? Because there's a lot of
I don't think that it does. There are huge fleets of volunteer drivers, and they were captured in the study about saying that was an essential part of, the best practice. And a lot of our rural transportation rated services are using that. And there was a graph that showed like the utilization of volunteer drivers. But even with that, when we're digging down into the data, they're still not being viable. So there's almost like there's such a great need that the number of volunteer drivers are not able to, and there's risk involved with volunteering. I don't know that those numbers were captured if they weren't associated with an actual agency. It was just a neighbor helping a neighbor. So that's an unknown, but I'm sure it's a part of the fabric. For sure.
Thank you. All right, what other topics, questions, anything top of mind for people?
Oh, anything?
Anything?
I'm just thinking about our PA process and wondering sort of how we're navigating that.
The prior auth process, yep.
Yeah,
So-
prior auth. Mostly, well, go ahead, but I'm just thinking about who's in charge, the who's in charge problem. And, DFR declined because they don't have medical expertise. I don't know who's gonna, Green Mountain Care Board's not, who.
Right.
And how are we gonna, well, what I'm hoping is we could connive something, if that's the right word.
Knife is not the right word. Okay, so I'll yes, let me,
Create, an entity somehow that can do that.
so I think I'm gonna go step back in regards to prior authorizations in general in the bill 766. Where we are is next week, we will take up the section of the bill that we have not taken up yet. And then we also have testimony on claims edits again. So Blue Cross Blue Shield will be back with the questions that we've asked them. And so we'll have a discussion there. And I'm drafting an email to the insurance companies based on our conversation yesterday to say we would like this data. I mean, we asked for it, but I just want to formalize it. And then we'll have them back in to do that. And then we'll start having some committee discussion. As the bill is written, yes, it requires some entity to help determine this process. If there is no entity, then we need to have conversations on how we get to the goal of reducing provider burden through reducing prior authorizations in a clear, effective way that helps still maintain quality of care and cost. We need to find a way to do that. And so I can't answer your question as who's in charge, because I'm not sure that's the way we're going to go, but those will be conversations that we have here.
So the process, just so I understand, is, we'll keep going forward, we'll keep getting testimony, and then will there be discussions amongst us or
As
somehow?
there always is.
Okay, that kind of,
Yes.
someone needs to come up with a bright idea, I guess, is what I'm wondering. That's a better word, bright
Right.
idea.
Yeah, well, and I think as we do testimony and have discussions, ideas come up. So, yeah. Ellen?
Okay, you were talking about, for authorization, we talked with MVP and Blue Cross. There was also another part of that was out-of-state insurers.
Right.
What authority do we
We have
have?
none. We have none.
So so we're
So-
dealing with just the people that
Right.
provide in-state.
Yes, so we are,
That's what we're-
right. And if you have a self-insured plan through a provider that's out of state, we do not regulate that. Often they follow what we have done. They may or may not, we have no idea, but, right.
Can I say something to that?
Of course.
Just the pie always gets put on,
Yeah.
get to like the little chin slice that we get to
Diet
control. The unsatisfying slice that we get to control. But, I mean, we just took testimony today from Medicaid, TIVA. And Medicaid's got that big chunk, and they told us that they're essentially already doing this. So that has a huge effect. Medicare, straight Medicare, I'm not talking about Medicare Advantage plans. That's a whole another thing that we can't regulate. But traditional Medicare also has no prior authorization requirements. And so, you're starting to fill in the pieces of pie. And then you take the little chintzy slice that we get and you add that in. And then you have the self-fundeds who are like, okay, maybe we'll go this direction. And eventually you've done something meaningful that I do. So I guess don't just look at that little piece and think, just because if we do it here, it's not going to have any meaningful impact, because it's about changing the story.
Right. And we wouldn't have had as many people testifying and have gotten as many written testimony they know the slice that we can regulate and not regulate, but that we have policy over. And they still came to the table and said this would be helpful. So.
And it seems like it's so problematic that any help, like any relief would be helpful, so.
That is the hope.
Yeah.
One more question. On the bill, it says it would also require health insurers, not healthcare providers, to collect cost sharing amounts from patients.
Yes.
That's copay, right?
Right. So that is, I'm going to ask that we hold those questions because that's the piece of the bill we haven't reviewed yet. with Jen. So Jen's gonna walk us through those sections on Tuesday. No, I don't know what day it is, one day next week. And then we'll get to
I
that
don't
section.
wonder how that would happen.
Yeah, let's save that for a testimony. That would be great. Easy.
I don't know if you wanted to keep the conversation to the couple of bills that we're moving through now, or if we can open it up
You can
to
open-
talk about, what's next. I don't recall if we had a discussion about kind of what happens after those two bills, what other legislation the committee wants to kind of look at this session.
Yep, we have not had those conversations because the focus has been on those two, but let's open it up. What bills do you wanna, just in general, like, are there topics that, I mean, I met with people individually before the session started, so I kind of have an idea, but let's use this time to put some stuff on the table. No decisions will be made today, but let's hear what people wanna work on.
Well, mental health.
Really?
Yes, really. I think there are a few up there that, I mean, can complement each other. So there may be some strategizing that we could do to make sure that several of our overlapping concerns and priorities get through.
Okay.
And we can efficiently do that together, I think, if we work together. But for me, I think that one urgent priority is really, there's a bill up there, 818, to establish a mental wellness and climate resilience pilot program. That one had a lot of strong support across the body. The administration had no changes to it. There's strong support in a lot of communities for that.
Okay.
And we don't have any real flood recovery supports for mental health. We
Yeah.
didn't do any investments for that. Nothing. It's all structural, which is great. But we need to invest more in community-based mental health. And I think often in this community, we look at bed numbers and crisis, and we need to do some upstream,
Okay.
pun intended. That one's my priority, but there are a couple other ones from last session that would really complement what Alyssa and Lori are doing in terms of the more technical Medicaid pieces. There's a rulemaking one with regard to updating rules from the 1980s at the AHS. I think those are it for me.
Okay.
What bill is that?
It's three, is it 362?
Oh,
Yeah,
updating statute language to reflect provider diversity.
No, hold on, I was writing them down yesterday. No, I can't.
Bobby?
Well, I just had a question. One of the short form bills that I still out there because I haven't fully introduced it yet. But it was one that was kind of like a hodgepodge of a lot of different things, but there's something in there that I was just curious about. You said we can't do any regulation of Medicare Advantage.
Right.
But I was wondering if we could do anything like we did with the crisis pregnancy centers about applying consumer protections to the way Medicare Advantage is advertised. Because that's the one part of the bill that I have that I feel like is the most timely and necessary. I don't know if that's within our purview.
So my understanding after talking to someone this morning is that the Senate is looking at that. Hold on, I'm just gonna go. Actually, we talked about committee liaisons just for House committees, but the Senate Health and Welfare Committee would be good for someone to follow.
I did talk to them last year, but I don't.
All right, Daisy's.
He really wants to do it. Go for it.
You two people on that one. You can work together, or as long as someone is updating me on there, but let me look real quick.
I think that was the one I had last year that I just remembered because I did go in there and talk to them when the compact bills came through. But maybe
Yeah.
that's just because I was doing the bill,
Yeah.
following the.
I mean, let me look at that. I think they are, and then it would come to us if they take something out. So let me find out and get back to you.
That's a great bill. I didn't mean to interrupt, but Bobby said short form and I remembered my most important bill, but I think a lot of you co-sponsored, and that was the a short form bill to explore requiring mental health screenings for depression, anxiety, and suicidality for school-aged kids.
Is that here? I'm surprised I didn't go to education.
No, it's not in schools, that's why.
Oh,
It's
okay.
just school-aged kids.
Oh, okay.
So
What
there's
is the
nothing
number?
about the setting. It's not here yet, but it's
Okay.
like 8:19, I think.
Okay, that's fine.
But it was just introduced, but that one, I think would be a timely conversation, and I'm hoping we can just explore, aligning it with the, American Association of Pediatrics, recommendations for screening at appropriate ages.
Okay. And this is not the last time we're gonna talk about this, so I know some people may not be prepared, but Melanie?
I would be interested in exploring if it makes sense, age 621, Representative Sedalia and I co-sponsored a bill looking at breast care imaging diagnostics, and it's requiring health insurance to cover diagnostic breast imaging services without cost sharing. And
Where's that again?
it's 621. It's a really big issue, and when we talk about people avoiding care because they cannot afford it,
Right.
that's a big piece of it. And even though we've heard yesterday that MRIs are now being covered in different ways, those are not the types of MRIs that can do this type of imaging. And it's upwards of $4,000 per image. And so some people, there was even a representative that approached me on the stairs and said, I have to go every 6 months. And if it wasn't for my special condition, then I wouldn't have it paid for and I would skip it, right? And so that's just the spending.
It is a big issue. So one of the things we were gonna do today, which then got postponed because we had more pressing things to do, is a review. Jen's gonna come in, Jen Carby, Legislative Counsel, is gonna come in and talk to us about how the process works, that if we require commercial insurance to pay for something that is not covered by our essential health plan, that it comes out of general fund dollars. So that is a very basic, I may not even be using the right terminology. So we're gonna have Jen come in and talk to us about that so that we can fully understand what the policy is. Because there's a lot of bills up here that are requiring insurance companies to do things. Coverage, of course.
Universal.
Yeah, I'm sorry, hold on. Claire moved them all to the side. So all of those are requiring insurance to cover things that aren't already covered. So that is so high level. I'm sure there's people listening to us and they're probably saying, gee, I don't know what she's talking about. So that's why we're gonna have Jen come in and talk about it. So I'm sorry, you had a question.
No, but what was that category? I'm just trying to get the nomenclature. You said that there's a body of things that are covered. What is that called?
Essential health benefit is what, when our 12th member of the committee, the healthcare advocate, is here.
Not to tee it up for it.
Right, not to, but if you don't mind me asking you, it was because of the Affordable Care Act, correct?
Defined in the Affordable Care Act, and it is what is covered in the qualified health plans. And we just went through a process 3-ish years ago to update it. And so that is indeed a factor, maybe for many bills. I think it may also make sense to have Jen talk about how the federal definition of preventative
Right,
crosses paths with any high deductible health.
okay,
And so that, sort of where you can have influence if you are not following those federal IRS
okay.
definitions.
So those are federally defined. So
So we will come back to that, educate all of us, and then decide what to do. Alyssa and then Leslie?
I should have said Mike Fisher Healthcare.
Yes, thank you.
No offense to anybody watching, but Daisy reminded me when she was talking about Bill that she wasn't sure what's up there. But do we have a technical change bill coming up?
I don't think we do, no.
Oh. I thought we usually do like a housekeeping.
Yeah, for Diva,
Well,
we haven't been approached, so.
Well, if we do, if I recall, talking about, essential health benefits, I think in one of our technical bills a couple of years ago, we had DFR just basically do a report on how much what would be the fiscal impact if we required.
Yes,
These
that's part of the whole, doing a whole
Yeah.
new, yeah.
And if you recall, that's where our audiology, our hearing aids came
yeah,
out of
yeah.
last year.
We funded hearing aids and not, fertility, yes, yeah.
So we've got
Right,
all those little bills. that,
Right.
Let's do this,
Right.
let's cover that, maybe.
yeah, so that, we'll talk about that
maybe
after
we could
Jen
do a
comes
little
in.
bill.
Yeah.
Let's study it.
Leslie?
Since Mari's not here, I'm gonna, sort of mention the PBM bill.
Yes,
Um,
sorry, that is on the docket yes, that is on the docket. We
Okay.
will be taking that up.
Great.
Thank you for that reminder.
And I'm interested in what's gonna come out today with the EMS report and what kind of legislation, and I'm not sure how that process might look. Is there a committee bill or something to?
There's a bill on our
Oh,
wall.
there's a bill on our wall and we just use that.
Yep.
So, yeah, I'm hoping that we pursue that, sort of then make the connection between that bill and this report,
Yes.
which we
So I
get.
will say, a lot of the EMS is most likely going to go to House Gov Ops because it's about system changes. But we'll hear the report, we'll do a walkthrough of the bill, and we'll see where we want to go.
The mental health screenings bill is 816
Okay,
and it's assigned to human services.
okay, interesting. Okay. Leslie, did you have anything else?
I have the short form facilities bill, so just the facilities fee bill, that is now, I asked Devin, for some.
Yeah, updated. Okay,
So she's getting us, they're getting us, Vaz is getting us data.
Okay.
So that's where that stands. I just want to let you know.
great. Again, just getting stuff on the table. No decisions are made of what we're doing, but stuff on the table.
Oh, I'm sorry. We tabled or pulled out of H 220 last year, the piece around education and safe storage. And, I didn't know if maybe we wanted to pick that up and try to get that back in there. I think, that law's been in effect now since July 1st. And I've actually personally heard from a lot of Vermonters who are wondering about the fact that it's really not being advertised.
Right.
Or, advertised is the wrong word, but that there hasn't been any campaign to let people know that this is now something
Okay.
in place.
So I think what would be helpful is, for that is, and we should do this anyway, because we've been asking for these reports, is for the Director of Suicide Prevention to come in and update us on all the work that he's been doing that we tasked him to do in legislation. So that should be something that we do, and then something might come out of that.
Okay.
Anything else for right now?
This is an ignoramus question. So there's the suit that's, sort of just going through the AG about that. How does that intersect? Does it at all, or?
We
Totally done.
still do our work, and that still progresses.
So it doesn't impact our work.
That bill. So messed up.
Okay, we're not gonna go in.
I know,
to
but
that
we're
right
gonna,
now.
we're gonna be bringing it back up, so.
Oh, yeah.
We're gonna be talking about education. Education of the policy that's in, the statute that's in place today. If we choose to talk about it, we're gonna have Chris come in, the Director of Suicide Prevention, and update us on the work that they've been doing. So I think that's the first place to start there.
Which was in H 47 now, or
something.
something.
Quarterly
Quarterly
reports
reports,
too.
right, yeah.
I'm gonna read those before it comes in, so we don't need to record.
All right, why don't we, do know that you can come to me anytime, or Topper or Alyssa, with what you're interested in, what you want to try and get to. I do want to say, I'm so appreciative of the first 3 weeks we've had here. Everyone has been here, engaged, attentive on some really hard, technically hard and frustrating testimony. So I really, really appreciate it. I don't know if you feel this way. I feel like we've started running at a pace that it's going to be hard to continue. And so I will be understanding of that, and we'll try to find space for us to slow down or give people space. But there's a lot, obviously, there's a lot of work to get done. So I appreciate the engagement that we've had so far. And know that you can come to any of us with concerns or anything.
Can I just point something out that I just realized? Every single thing that we have done out of this committee, other than the 2 bills that are sitting in appropriations right now, has an act number next to it. Everything that we put out has got an act number.
And Claire, thank you for putting the X on.
I just saw that right now.
That's impressive, because there are things that move out of committees that then sit somewhere else.
Yeah.
Like that new font.
So, that's, Jason.
The other thing, I think, thank you, Lori, for recognizing we've started at a rapid pace. We've, I think, done really awesome at that, in part because our committee assistant is.
Yes.
700 emails.
Down.
Every 2.3 seconds.
Right. All right, let's be done. Thank you for the good conversation. We're back.